we're always outsourcing our own inner wisdom because that's what the system has taught us to do. Like, oh, you need to do the X, Y, and Z. It's so prescriptive. There's no collaboration. And then sometimes the system is so brainwashing that people even feel like they're supposed to be told what to do. I've had many patients, like if I try to be collaborative with them and no fault of their own, they'll say, well, you're the doctor. You tell me what to do, because they've kind of gotten disconnected from their own internal wisdom. And then just the media and capitalism. And it's like, you need to buy X or Y or Z to be whole or to be beautiful or to be healthy or to be. So it's always this outsourced message of like, you're good enough, you're worth it, you're okay. So our systems are not helping the self-trust.
And that is one of the biggest pieces. They're showing up with pen and paper like, okay, tell me how to change. Tell me what to do, right?
Yeah.
I know it can be confusing in the beginning, especially if you've never trusted yourself of what does that even mean and how do I do that? But it will be the best medicine for you long term. Hey there, and welcome to the Heal with Grace podcast. I'm your host, Grace Secker, and I'm a holistic licensed therapist and nervous system coach who believes that the chronic and often unseen symptoms you're living with are a sign of something deeper going on, a sign that your nervous system needs attention. In each episode, I'll share the science behind the most common chronic health disorders, plus holistic tips using mental, physical, and spiritual practices. You'll hear what I've learned in my journey and the true stories from our trusted guests, so you can feel less alone in your experience and give yourself grace no matter what you're going through. So without further ado, settle in and get cozy. It's time to heal with Grace. Hi, Dr. Rita. Thank you so much for coming on the Heal with Grace podcast. I'm excited for today's episode.
Yeah, I'm so happy to be here with you. Thanks for having me.
You are welcome. It's been some time, like a while for us to connect. We've gone back and forth about it and scheduling stuff. And so it's definitely time. And I first saw you at the ATNS conference last year when you were speaking with Monica, I think. Yeah.
Yeah,
I loved that
gosh, I
conversation.
couldn't believe it was so long ago now. It was like yesterday.
I know. Yeah. And I thought it was wonderful. And so I know that it would be a great episode to have you on. So let's first have you introduce yourself. Tell us a little bit about you, how you came into this field, and yeah, we'll go from there.
Sounds great. So just a little background on me. I feel like I always have to start with what I was studying in undergrad before I became a doctor, because it kind of gives me insight. You know how when you can connect the dots, like even far back to our childhood, and just like we're meant to be on this path.
Yep.
And it's a calling. And I know that you understand that. And
Mhm.
that's why I love being here with you today. But yeah,
Mm.
so like in college, I actually was a French literature major, and I
Mm.
just loved story. Like I just loved hearing, like I read some great works of art and literature like Emile Zola and Lautréamont. I loved the story and of looking at like people's inner worlds, like what's going on in their conscious and subconscious, and like what were their motivations, what were their fears. And it really was kind of what brought me to medicine, because medicine is of course science, but it's also such an art, and it's a practice, and it's really about understanding humanity and the human condition.
Mm.
And
Yeah.
so as I was a primary care physician for almost 20 years, I started seeing a huge pattern. I started seeing like my patients were still suffering, even though like I was offering them all the tests and diagnostics and medications and procedures. And one of the things, a lot of my colleagues have said in this field too, is that as a primary care physician, patients come back to us. We will send them to the specialist, but we kind of see the whole picture. And so I was seeing this pattern of, and I have access to all their medical records. So I would have access to their, all their, neurology notes or their gastroenterology notes or all the different, specialists they saw. And it was like, I was like kind of with there, like sitting next to them in their journey. And it was really like it was really demoralizing. I mean, just to be very honest and open about it, because I wanted to be able to, quote unquote, fix their problems. I wanted to be able to help them. And I really realized that I was not helping them. And I saw this big gap and cracks in medicine. And I think life gives us what we need sometimes. I try to look at it that way. And I had my own injury and my own pain. And I think it wasn't just a coincidence that I did, because it also was kind of me carrying all of that experience of what I saw my patients go through. It's almost like life gave me the pain, because that's when I couldn't even physically go on because of my own health issues. And I became in my patient's shoes, like looking for every option. Like, how do I fix this? How do I get better? I ruptured a disc in my neck, and I basically was almost like told surgery was my only option. So it led me to my own path, and I pursued integrated medicine, mind body medicine, and I could probably go on for the whole hour about my story, but basically, it's what really brought me to this work, and it's really been life-changing for me for my career, because it's brought me tools and a way to help my patients get better, and also for me to live a better life. So, there's so much gift in that, but of course, it comes at a lot of suffering and struggle and lived experience, but I mean, we can bring that to our patients and clients.
Exactly. I mean, there's 2 things. One, I would wanna hear more because I especially being a primary care doctor, you just don't hear that enough, right? Being in this world, I've talked to many, but it's rare, right? It's rare for you to open up the possibility of how can I help someone? And then also, obviously, how can I help myself when you're going through it in your own body? And so I just think it's really, really powerful to hear that from someone in medicine to have them open up to, yeah, there's plenty of ways to help someone, right? And what you were seeing wasn't really helping as much as maybe you wanted or thought it could. So first and foremost, thank you for doing that, for opening up. And also how far into being a doctor did you have your own journey and then how did you find the mind body medicine world?
Yeah, I wish it was sooner, but I was already pretty much practicing for almost 15 years at that point, and I was very much the push through, like, my body needed to obey me basically, and I was kind of my head was disconnected from my body, so I was just really much into, you know, a lot of times we go into these healing professions, of course, we wanna make a difference, we wanna serve others, but there are some deeper wounds of why we go into this. We feel we have to prove our self-worth, like by helping others, by being of service. So I had some deeper wounds where I felt like I needed to prove that I was good enough, that I was capable enough to be in this position of serving and, being in an intimate relationship with my patients, because it is a privilege to know so much, as you know in your field, about people's lives. And it's a lot of responsibility too. So I think I had those deeper wounds, and I also think that my chronic pain journey was me drawing attention to those wounds. So it did take a while for me to get into it, and it's a process, it wasn't linear. There was a lot of questioning and turns and twists, and there still are, but it's really rewarding.
Yeah. Yeah. And so now, what is your focus in primary care? Is it general? Is it mind body? Like, how do you help people now?
Yeah, so now I've actually left my role as a primary care physician
Mm.
and completely focused on the mind body approach, mind body medicine, neuroplastic medicine, and really integrating all the modalities I've learned, like, even from just integrative medicine where it's, Ayurveda and traditional Chinese medicine to also integrating like PRT, pain reprocessing therapy, emotional awareness. And also, I'm almost completing my mindfulness and meditation teacher certification. It's been a 2-year journey. So I, really feel like that has really helped me in deepening my PRT work and also the emotional work. So it's really just integrating everything and my lived experience and just my experience of being with a primary doctor as well.
Sounds like we're similar
Mhm.
and exploring in different modalities and blending them. I mean, I have so many ideas of, "Oh, I wanna do that training," or almost went down the functional route medicine route one time or integrative route, and then this and that. There's so many things, and just even having like, there's that student fire within you of wanting to understand, right, and learn and experience for yourself, and then bringing it to the people that you help, which is, I think, one of the most powerful things you can do as a helper, as a
Yeah,
healer. Yeah.
yeah, I agree. Yeah, there is that fire, like you said, just to learn,
Mhm.
and it's fun, like it's really fun when you can help people and they get better and you learn information and it changes you, like, psychologically and physiologically, and it just makes you excited. You know what I mean? It's just like, there's hope. There's a way, and I love how this work is so personal and individual too. It's just
Mhm.
a lot of times in medicine, we need the algorithms because, you know, that's how we get out, traumas or acute situations. I don't know if you watched The Pit. It's a
No, my partner keeps telling it, but I have my own response to watching medical shows, so it's a little too much for me, a little too much drama.
I don't blame you because it can be like it's actually like not to digress, but for me, it's been kinda educational because it made me realize how disconnected I was because you're just like you're
Uh,
shifting from, like, one thing to another, where you're telling someone, like, life and death news to, dealing with some acute situation to, like, dealing with
mhm.
someone's grandmother who's just telling you about, something sweet, like, it's just a lot of chaos. But
Yeah.
anyway, yeah, so it just gives, I don't know where I was going with that, but
Yeah, I mean, well, bringing it back to what you do now, right? Integrating
yeah,
and helping people in maybe in a different way instead of being so disconnected from how you're approaching.
yeah,
Yeah. Yeah.
yeah,
So, one of the topics I wanted to get into today was two things that kind of overlap. One, you talked about recently how the more that we either push away pain or fight pain or categorize it as bad or chronic, right? The less we actually have capacity for it. Maybe we become more sensitive to it, which I think we should talk about that because I say that and I'm like, "Ooh, people are gonna hear this and think I'm telling them they just have a low capacity for pain or they're too sensitive," right? Which is not the case. Let's start there before I get ahead of myself. Like, what would you say to someone who is like, "No, it's not. I'm not too sensitive," or like, "I don't have a low threshold for pain. What are you talking about? I have so much pain." How would you approach that?
yeah. I mean, first of all, like, I always start with, like, just the experience of living with that type of discomfort, like, and so unpredictable, and it's so relentless. It's really hard. I mean, it's just really, really hard, and it's not about being sensitive, it's biological and it's neurological, like, your body is in constant threat, stress, discomfort. I mean, there's no space, and it's really hard to feel a connection or relationship to yourself or your inner world or, I like to sometimes say our true selves. It's really that gets really muddied, and
Mhm.
I think the more we try to fix or avoid, that creates more of a threat response in our system. So then that threshold gets lower and lower, and it's basically a loop. Like, bringing awareness to that alone could be very healing.
Mhm. Yeah, exactly. I was with a new client yesterday and she was saying something kind of similar to this. Like she's been in my program learning some of the tools and the skills. And she was like, meditation just doesn't, I can't do it very well. I just have too much pain when I sit there and I can't pay attention. And as we did it in session, it was more of a recognition that yeah, when she quieted down and closed her eyes, then the sensation of what she was experiencing in her body, which she categorized as pain, was increasing. And so then, of course, you automatically, biologically, right? You say, oh, that's bad. That's wrong. That's not okay. This is too much. And that's, I'm guessing, kind of what you're saying is, yeah, obviously, that's hard, right? What we know with pain science, with PRT, and what we do is breaking that cycle is actually what helps decrease it. Right, and it just made me think of that because that's exactly what was happening yesterday, where it was like, she's just really afraid of going into that, which understandably so,
Yeah.
obviously. But as you mentioned, like, our expanding ourselves, right? Expanding that capacity to be with it actually dials it down.
Yeah. But it's like we have to go into the unknown or the uncertainty to get to that place. So it's like that dip down. But I
Mhm.
think just bringing awareness is the first step, is just saying, like, I am resisting that. I am resisting the being with, instead of that noise of like, it's too loud, I have to stop. Like, you're seeing that nuance. There's a little bit of there, it's subtle, but there's a little bit of space there. And
Mhm.
then if we can keep going there slowly and slowly, because I think we talked before we decided to meet about what we were gonna talk about, and we said self-trust, and how do we build self-trust when we're in so much pain and so many symptoms? I think it's what you're touching on, is when we can be with that pain
Mm,
and not collapse, or even open up, just even like we use the 1% or the 5%, but it's really, that's how we rebuild self-trust, because it's not like something we have or we don't have. It's something that kinda ebbs and flows, so it's, you know what I mean? It's there. It's just we kinda have to rebuild it, and so when we can just be with that sensation and know
mhm.
that we can be okay, like, "I can handle this," that's how we build that trust in ourselves, and then that's also how we kind of have relationship to our authentic self, is through self-trust. The process of self-trust is where we really discover who we really are and wanna be in the world, our deeper purpose.
That's what so for someone listening who's like, "Okay, I'm tapping into this work," right? I'm starting to understand that there's a mind body or like a nervous system component to what I'm experiencing. The concept of self-trust might not even be in their vocabulary, right? So how would you broach that with them of like, okay, the reason we're taught when they're like, well, I'm just having these physical sensations. What are you talking about self-trust? How do you talk to them about, okay, actually there's probably a lack of trust, which is actually increasing that cycle of fear in your body.
Yeah.
Yeah.
Yeah, I would kinda go to other areas, like, what are your values? What do you care about? What
Mhm.
matters? Because that kind of intention sets a direction towards
Mhm.
what's important to us. And sometimes self-trust is about kind of just being in alignment with what's important to us, what matters. Because you'll hear that in people, like I was sharing with my story, and your story probably too, is like when we get ill or we have a really big life challenge or we suffer, we start realizing, like, what is really important to us? What matters? What do we value? Then that becomes our guide. And then we can even look at emotions too. Emotions are really valuable information. I mean, I sometimes when I'm really scared about something, it actually can tell me, like, well, this really matters to me right now, because I wouldn't be scared right now if it didn't matter to me. What's underneath that,
Mhm.
And maybe there is some other emotion or a belief, or it's a doorway.
Yeah.
So
I
there's
like
different
that in.
things.
Yeah, like that in with values, right? And because when you're not living within what you value, it is harder to trust yourself or even have that, right? Because you're not trusting that you're living in alignment. And so, why do you think it is? Like in the beginning, when you're going through maybe your story, like when you were going through this journey, why does it make you confront that? Confront why you're not living in alignment. And yeah.
I think it goes to that idea that, like, if things are status quo in our life, it's really hard to change because change is uncomfortable and it requires us going into the unknown. Even good changes, even exciting events in our life can be very stressful because our brain, as we know with the neuroscience, loves predictability, loves, to know what's going to happen for certain. And I think that when we feel uncomfortable, um, it it can be really challenging, but when we get a life-changing event or they say everybody goes through this at some point in their life, some catastrophic or life-changing or really hard time, whether it's illness or loss or, it could be anything. And I think that's what pushes us because that the comparison of what we're going through to having to change, the change is less uncomfortable than what we're going through. Basically,
Yeah.
that's where we get that entry point. So that's why there's almost like a gift or, we can call it even the hero or heroine's journey, like, in that our transformation. It's our doorway to living the life we really wanna live because we really go deep and then we go, "Really matters to me right now." It's like when we're in those and not to be dramatic, but sometimes those life and death situations, what do we
Mhm.
think about? We think about what really matters.
Mhm.
You hear stories about people on their, unfortunately, like, last days of life. They really talk about what really matters. And so yeah, that's what I would say on that.
Going through, you're right, specifically with pain and illness, this journey that we help people with going in the mind or body journey and that you and I both have been on, it is life changing. And there's a reason for that. And there's a reason why a lot of us can say, actually, we're grateful for that journey. Where if you're in the beginning of it or you're in the middle of it, you may not be able to see that. But it's really true. It helps you actually get into the life that is more in alignment with yourself, where maybe you didn't realize that before. I talked to a lot of people that are like, I don't know, things were fine.
Yeah,
Why am I having this? And so you can't always see it, but that's why it's there. Like I love that you said that. I mean, we have to get uncomfortable to make a change. We're not just going to wake up one day and
yeah,
change our life for a random reason.
yeah. It's not about willpower or being strong or weak or it's biological. We're wired for that. Like, we're not gonna, uproot everything unless
Mhm.
we're really uncomfortable and our system is like, "Well, we have no choice." We literally have no choice.
What did it look like for you when you confronted maybe your values or your trust with yourself? Like, how did you move through that and how did it help your own self trust?
I think anchoring into my values really helped because when I felt that I was living in integrity with my authentic self of, like, what mattered to me in terms of, like, how I wanted to show up for my family, for my husband, for my daughter, for my extended family, friends. Like, I wanted to be somebody who could feel honest in what I was saying. And
Mm,
I think when I did leave my role where I was before, I didn't feel like that alignment sometimes because I was not offering the medicine I felt my patients or clients needed because of the structure I was in. And this is not to, like, dismiss the structure I was in. It was functional and it was worthwhile and it was valuable. But that's what made me realize I needed to make a change and be in integrity with myself. And of course, it's like timing of life, I'm like already done 20 years in that model, but I really found it to be liberating and in alignment with my values, the way I'm showing up for clients now, the way I'm practicing now. And so I didn't realize how, like you said, you don't realize it, but when I did that, I felt a huge shift in my body. Like I just felt like this, like my shoulders were like finally like, wow, I'm doing what is valuable to me, what is meaningful to me. I know this may sound like, I'm just shifting gears a little bit, but to me, it was a really physiological change too. And I noticed that I was less irritable with my family. Like, I just noticed so many levels. Like, I showed up more like Rita,
Mm, mhm.
by making that change. And it was a really difficult change for me because I had, it's like when you've been on a certain path for 20 years to like steer the car off that path. And I had doubts and I had my brain, my skeptical brain kept saying, gosh, like, what are you doing? Like, you should just be thinking about retirement now and getting all your ducks in a row. And yeah,
Yeah. It's a change like that, a change that your body brings about for you through pain and illness, like to get your attention. It's never gonna be like, "Oh, I realize I wanna make a change to be more in alignment with my values and my life." And, "Okay, cool, now it's great, and it all fits together, and the puzzle pieces work," right? It doesn't work that way. I've never heard anyone talk about it that way, right? Like,
yeah, exactly.
back and forth to challenge you, to really, like, to challenge, "Okay, is this actually right? Is this, is this important?" And the question I get for myself all the time is, do you feel like you had to make that change in your life for your body to have a reduction in symptoms, whatever your symptoms might have been? Do you feel like that was important, or do you think that, I mean, you can't know because you didn't stay, but, the question is like, do I have to make a life change for my symptoms to subside? How do you
Yeah.
approach it?
I think for me, I did. Like you said, for all the puzzle pieces to fit, that resonates a lot because there are going to be some, I don't even want to say good days or bad days. There could be moments where even in a moment, you're like, I'm having a symptom or something happens. And then like 30 minutes later, it's like, okay, I'm fine. It can be so fluctuant. But I think overall, like, I can move in the world and show up in the world in such a more easeful way that impacts my body greatly.
Mhm.
And I have seen in my clients that when we can listen to our body sensations and advocate for ourselves, it does affect our symptoms. It does create relief. But I always love what Alan Gordon has said. I don't know if he wrote that in his book or he told us in one of the trainings, but he's like, I don't really care what happens to your symptoms. I just care about how you relate to your symptoms. And I really feel like that is how I approach this work because I don't like to say your symptoms are gonna go away or you're gonna get relief. I mean, I hope you do, but I can't control that, I really can't. Like, it's like if I prescribed a medication to someone, I can't control that they're gonna get better. Maybe 90% of people do, and they might, but if I can change their relationship to their symptoms so I think he also said, like, "I don't want you to care about your symptoms too." Doesn't he say, like, a phrase like that? Yeah,
Mhm.
maybe that's what it was, exactly. I don't wanna misquote him on this podcast, but
The
basically
general subject, the general idea, yeah.
yeah, but basically, it's not like I can have my pain, but I won't seize up about it, or I won't make a meaning about it, or I'm just like, "Okay, here you are. Maybe this is telling me I need to take a break, or maybe this is telling me, like, that I just wanna say hi to you, or maybe this is telling me I'm hungry." I don't know, like,
Mhm.
there's less of that emotional charge with the symptom, if that makes sense.
Yeah. Yeah.
And it's about the capacity you brought up earlier. It's trusting that my body knows how to take care of me and my body knows how to tell me how to take care of it, and I can trust in that.
Yeah. As you're saying that, what just came to mind for me, which I think about a lot even before my days of specializing in this and just being a therapist, a mental health therapist, is like what you just said. I thought, man, if we could just teach that like in schools, it's not that complex of a concept, right? Learning that our bodies are ever evolving and wise and have a different relationship with our symptoms, our bodies, or whatever is happening in our life. That is just man, that would change so much. Uh, and so when you're saying that, I'm just like, yeah, that would be that's so much of this work. It's so much of teaching and educating people about how to have a different relationship with your symptoms, with yourself, with your values, with the people in your life or your career, your job, whatever's happening, right? Instead of trying to force it or make it be a certain way, because that doesn't work very well often.
Yeah, absolutely. You said it really great. And as you were talking, I just realized like pretty much this applies to every area of life, right? Like relationships, circumstances, situations. It's not like we're saying give up your agency or giving up your free will. It's really about just not trying to force and control and
Mhm.
like finding that balance. You said it actually so well.
Well, I think actually what you're saying is it's actually the opposite. It's actually giving voice to what is your true voice, right? More agency and authority and a voice instead of it being either suppressed,
Yeah.
especially and that's very common, or just expecting that voice or ourselves to be someone that we're not really, just based on what we've learned we thought we should be or who we should be.
Yeah.
So it's more about, yeah, giving that sense of self and agency and authority.
Yeah. And trusting our voice. Yeah.
Mhm. Which exactly, that is I think self-trust ends up coming in a little bit later in this journey, depending on the person. I think sometimes in the beginning, it's really just stabilizing and understanding the pain science and your brain and body connection. But really throughout the whole process, you are learning to trust yourself more, regardless of the phase. Are you in the education phase and just learning about this stuff? Are you kind of retraining your brain a little bit and stabilizing, grounding yourself?
Yeah.
Or are you diving deep into your values and your parts and who you are? I mean, it all goes together, but I think for a while some people are like, "Oh, I'll get to the deeper stuff, when I get there." But it's it's all throughout. How do you see that? How do you see the self-trust piece moving going into all this?
Yeah, I think you named something really important in that it's happening throughout, even if we're not naming or consciously acknowledging it.
Mhm.
We are trusting ourselves just by even starting the journey and learning the pain science and seeing how the evidence of the neuroplasticity and the symptoms, it's already the process is starting. And I think we just know how to trust ourselves too. We're biologically wired to, but all the modern day world, I mean, we live in systems that don't really tell us that it's okay to trust ourselves. Even like the medical system, we're always outsourcing our own inner wisdom because that's what the system has taught us to do. Like, oh, well, you need to do the X, Y, and Z. It's so prescriptive. It's so like there's no collaboration or and then sometimes the system is so brainwashing that people even feel like they're supposed to be told what to do. Like, I've had many patients, like, if I try to be collaborative with them and no fault of their own, they'll say, "Well, you're the doctor. You tell me what to do." Because it's like they've kind of gotten disconnected from their own internal wisdom. And then just the media and capitalism, and it's like you need to buy X or Y or Z to be whole or to be beautiful or to be healthy or to be so it's always this outsourced message of like, "You're good enough. You're worth it. You're okay." So our systems are not helping the self-trust.
You know, and that is one of the biggest pieces, obviously. Obviously, it's a little bit different. I feel like when people come to therapy, they have some sort of idea of, it's collaborative and I can't just fix them. But there's a lot of that where, they're showing
Yeah.
up with like pen and paper, like, okay, tell me how to change, tell me what to do, right?
Yeah.
And so that conversation often. I know it can be confusing in the beginning, especially if you've never trusted yourself of what does that even mean and how do I do that? But it will be the best medicine for you, I think, long
And
term.
it can be really a unfamiliar approach because of the way we've been
Mhm,
conditioned. And
mhm,
it can make us frustrated to we wanna have the answers, right? Like, it's just really frustrating when someone says, "Well, let's work on this together." And they're like, "Wait a minute, you're the expert, you're supposed to help me." So it's like sometimes just honoring that anger, like,
mm,
unfortunately, it doesn't work that way. We
mhm.
wish it
Yeah,
would for all of us, right?
exactly.
Wouldn't it be
That's why,
great?
like, the word collaboration is really important. It's not like we're just saying, "Oh, go and meditate in the forest and figure it out," right? But also, if you're sitting there just telling someone what to do and prescribing medicine every day, like, that's not gonna help them long term either because 'cause they're not building that sense of self. So, that collaboration is super important. That's why having a mentor, a guide, a coach, teacher to help you, but also help you get like, develop your sense of trust,
Yeah.
right, and intuition.
Yeah,
That's
definitely.
yeah, that piece, that word is super important in there.
Yeah, I think we all need support. I mean, I know I have my own coach, mentors, and I think it's a lifelong process. I know I not to name celebrities, but I know a lot of, like, I've heard talks of very well-renowned speakers, and they have, like, a whole team. Like, they have people there and it doesn't matter how old they are. They could be in their 80s and have, like, their own mentor and coach, and
Mhm.
doesn't matter, like, we all need a sounding board, we need a mirror, we need support because our brain is like that puppy. We have to keep saying, "No, no,"
Yep.
in a gentle and most loving, kind way.
Yeah, exactly. As human beings, we're literally not meant to live alone, right? We're meant to
Yeah,
live in community with people, and we all have different roles and mentorship and guides and students and teachers and all the things. So, yeah, definitely. I mean, I always have. I've talked about it on here millions of times. I've always had someone, some group, a mentor, something, right, to kind of help me with whatever's going on. There's no way I'd be where I am today without it.
yeah. Yeah, we all need it. In the meditation community, we call it, like, our sangha, like,
Hmm.
our community, and even when I meditate, just meditating with the Sangha, it's so helpful to just have other even if it's online, it's just like having everyone's presence and we're just sitting, with our eyes closed, but it's so therapeutic,
Yeah.
do it together.
Yeah. Yeah. That's why I love groups with this work, and I feel like there's always gonna be some sort of group work that I do, especially because people are really isolated in this journey, right? If you struggle with chronic pain and illness, you can feel so confused and like no one gets it.
Yeah.
So even just that level of being in community with people that get it, I think is super important. And then obviously yeah.
Yeah, I agree with you. Yeah, it's so important, and it's even really healing, like, to continue even if you're, like feel like you're fully recovered, just to have community to, like, and your presence probably, if you're already on your healing journey or felt a lot of relief, it provides so much comfort to those who are starting or in the middle of it, and it's
Mhm.
just such a good feeling all around to be a
Yeah.
part of these healing communities.
Yeah, exactly. Okay, so if there's anything else around what we've talked about today, like self trust, capacity, and really just understanding that, you and your body are your own healer, obviously, with the support and the trust. Is there anything else that you feel is important to note around all this?
Yeah, I think when our brain tries to say, like, if, we're in this healing journey and our brain will say, well, like, we have to fix this, we have to get better, like, what's the next thing we can do? I just would say maybe try to see if there could just be a little bit of a pause in that kind of, cascade of thoughts and ask, like, how can I just be with this sensation right now? I know it sounds really counterintuitive because it's like, okay, I don't wanna be with this sensation, I want it to go away, I don't wanna feel bad, I'm tired of suffering, But if there's a way to just say, like, "How can I just be with myself right now through this sensation?" Almost like you're holding yourself, like, as you're feeling this discomfort. Because by just doing that, it's like building that self-trust, that capacity, even if you don't feel like it is in the minute or in that moment. And it can
Yeah.
be that simple.
Thank you for saying that. That is very important because you're not gonna understand it or wanna do it in those moments in the beginning, but you are building that trust and capacity.
Yeah. And if it's nurturing, you could, take a deep breath, or if that's triggering, you could just imagine your feet on the ground, with the earth supporting you, or listen to Grace's podcast while you're doing it.
Yeah.
And just know that there are a lot of people out there who care about you and want you to feel better, and to know that people care. And it's not because I know we use this phrase a lot, but we aren't broken. It's just we're actually like learning to really take care of ourselves and what matters most.
Yeah. Exactly. Thank you. Thank you so much for this conversation and for saying that. No, I never know. Like I told you before, I don't plan these out necessarily, but I have a topic in mind. And I think that the way that you speak about some of these topics and just you can tell the journey you've been through and the work that you do comes through. So thank you for the work that you do for yourself so that it also, helps others because I mean, as mentioned in the beginning, it's cliche, but it's very true. Like I think if you're walking the walk, that makes you the best mentor and helper and teacher you can be.
Yeah.
So
Well, thank you for saying that, and I'm really glad because that makes me feel good.
yeah. Good, good. Okay, so I will obviously have all these links below, but can you share with us like how people can find you and what you're offering? How do you help people now?
Yeah, I'm happy to. I have a kind of a program with helping people. It's through one-to-one work, and my I'll give you my website information so people can reach out to me there. I also have been doing some workshops with Ellen Alden. She has my
Mm.
COVID community, so I do join her community twice a month for Q&A. So if you'd like to see me there, you can. And then I'm hoping to start offering some group programs and coaching. I will be also doing some more mindfulness meditation talks as well. So stay tuned.
Amazing. Looks like a lot of good things to come. Cool. All right. Well, thank you again, Rita, for coming on. And I know this will be helpful for everyone. It was good to talk to you.
Yeah, thank you so much for having me, and thank you for offering this for the community as an opportunity to share our stories, because we all heal when we can share our stories too.
Exactly. Exactly. Well, stay tuned, everyone, and I'll talk to you next week.